Okay, the screen is clear for all of you. Yes, Lena or Lana. Okay, the screen is clear for you. Fatma. Yeah, okay. Yes. Start. Okay, now we will try to go quick because actually I take about 25 minutes to solve something related to the processing here. Okay, thanks. This is about the bones of the skull. Uh, the main objective of this lecture, we try to describe the common features in different view of the skull to identify the information or the different position of the skull, and also to identify the important features and foramina in the area of the different view of the skull. And we'll discuss briefly about the separated bones, and we'll try to share the most important clinical points related to the skull. Generally, the skull consists about 22. What is this? Okay, the screen is clear for you. You can open the microphone and you can answer me, please. Yeah. Okay. The bony part of the skull, about 22 bones. These bones are articulated together by the means of sutures. That means primitive articular or primitive joints connected each others at the fibrous tissue. Just we have only one mobile bones in articulation, TMJ, the mandible articulated with the upper area or the base of the skull for mastication, and also we have a free attached or muscular attachment for the bony part, which is called the hyoid bone at the base of the tongue, responsible for the or increase in the swallowing of the food and others. Also, according to the anatomical functions of this group of bones, you can divide the bony part of the skull into the cranium part, which act at the brain box, and we have the facial skeleton, which form the skeleton of the face, and there is associated bony part may be included inside the skull or inside the bony part of the skull, like the ossicles of the ear, of the middle ear, and also the hyoid bone, which has a little bit descending position below to the level of the lower jaw. The cranial nerves or the cranium about 80 pores, while the facial skeleton about the what is going on here? Okay. 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 This is the general view of the skull. We have the normal view of the skull, norma fortralis, that means face-to-face position, and we have the posterior view, which is called the normal occipitalis. This name comes from the most major bone which share in the formation of the view. And also we have the norma lateralis on the lateral side of the skull, and we have the norma occipitalis and the norma disalis externa, that means from the external view of the skull, and we have the norma disalis interna, that means from the internal view of the skull. Is formed by the frontal bone, as you see here, the yellow color or the orange colors, and also consists of the bony part which form the bridge of the nose. And we have the major opening, as you see here. We have the orbit on both sides, and we have the, in the central part, we have the nasal cavity, and the oral or the two jaw, the upper jaw and the lower jaw, which act at the oral fissures for the oral cavity. That means include the entrance of respiratory system and the digestive system. The orbit is consists of the roof, as you see here, and floor, and also we have medial wall and lateral wall. The body part of the medial wall and the lateral wall, most of these body parts share together to form the difference part of the or difference wall of the orbit. The lateral wall, it consists of this sphenoid bone, and also here we have the or most posteriorly we have the palatine bones related or nearly to the posterior nasal apertures. From the lateral view, you can see the nasal cavity. This is the lateral. More in the most upper part, we have the frontal bone, and then after the frontal bone, we have this bony part which called the sphenoidal bone and ethmoidal bone. This act at the most superior aspect of the nasal cavity or along the lateral aspect. And we have the maxilla laterally, and this from the maxilla we have the lacrimal bone, and also we have the inferior nasal conicae which act as a separated bony part on the lateral aspect of the skull. Medially we have the nasal septum. This nasal septum consists of cartilaginous part, as you see here, and also we have the perpendicular plate of ethmoid bone in superior position, and inferiorly we have the vomer bone which act as the septum bone to separate the nasal cavity into equal half, the right half and the left half of the nasal cavity. Around the nasal cavity we have the pneumatic bones. These pneumatic bones consist of the hollow cavities. This increased the nasal cavity and also communicated with the nasal cavity on both sides. And as you see here, we have the frontal sinuses which are related to the frontal bones, and we have the small sigmoidal sinuses which are related to the sigmoid bone, as you see before. And then we have the sphenoidal sinus, and this at the base of the or most posterior aspect of the roof of the nasal cavity. But the most dominant one and the largest one is the maxillary sinus, which open direct into the middle part of the lateral wall of the nasal cavity, and is communicated direct to the nasal cavity, and this is the site of the sinusitis or common site of sinusitis. Then also in the paranasal sinuses, most of these paranasal sinuses had the same lining epithelium of the respiratory system, and also responsible for the lighting the skulls, the weight of the skull, and also give the resonance and specific voice tone. This is from the anterior view, and the major opening which lies in the anterior view. Then from the posterior view, you can see the norma occipitalis, the norma occipitalis, the bony part which share in the formation of the norma occipitalis, mostly the occipital bone, and we have, as you see here, part of the parietal bones, and also this view you can say, or we have a specific term for this view which is called the submental view. Submental view, that means on the posterior, a little a bit downward toward the skull. This actually during the X-ray you can try to check the fracture at the different part of the mandible. Then also we have the switches, as you see here. This is the largest switcher along the posterior aspect, which is called the rhomboidal switchers, and in the central part we have the posterior aspect of the switcher, which is called the sagittal switchers, and also the junction between the sagittal switcher and rhomboidal switcher has a specific term which is called the lambda. Then we have these most dominant features in the middle part of the norma occipitalis, which is called the external occipital protuberance, and we have two lines radiated laterally from this area, which is called the superior nuchal line and inferior nuchal line. These lines give attachment for the muscles of the back, or muscles related to the back of the knee. Commonly the opening in this area, just we have the emissary opening to communicate with the extra cranial veins with intracranial veins to control the pressures of the brain inside. Then also from the lateral aspect we have the norma lateralis externa, and we have the bony part which share in the formation of the norma lateralis externa. We have the part of the frontal bone from anterior, in the middle part parietal bones, and most posteriorly we have the most lateral aspect of the occipital bone. The most important features in this area, we have the temporal bones, as you see here, and these temporal bones joining anteriorly with the lacrimal bones, and posteriorly has extension downwards, which is called the mastoid process. The common features on the lateral view, we have the external acoustic meatus, which is related to the ear, and also here we have the switchering part, which is related to the, or to joining the parietal bone with the frontal bone, part of the coronal switchers. This part of the coronal switchers with the switchering with others, the squamous part of temporal bone and also the wing of the sphenoid bone form the H-shaped switchers, which call the pterion, and this is the weak point on the lateral aspect of the skull. Also, as you see here, this also the joining between the switchering between the occipital bone, parietal bones, and the mastoid process of the sphenoid bone, and also this is the weak point which is called the asterion. The asterion actually and the squamous bone can communicate it together, and also communicate it to the posterior aspect of the middle ear. Then we have the norma lateralis interna, that means from the lateral view but from the internal vision, and the most important features is the groove for the middle meningeal artery, which radiated at extra dural position, and most clearly at the posterior and anterior division to supply the dura mater. And then the bony part, we have the same bony part on the lateral aspect. In the norma bisalis externa, that means from the base of the skull, which is related to the area of the articulation between the atlas and the base of the skull at the level of this condyle, which is called the occipital condyle, to form the atlanto-occipital joint. Okay. Then on the same area we have this part of the norma bisalis or norma bisalis posterior aspect, and here we have the middle part of the norma bisalis externa, and we have the anterior aspect of the norma bisalis externa. The norma bisalis, or the anterior part, commonly formed by the bony part of the hard pellets. In the central part we have the incisor fossa, which is related to the incisor teeth posteriorly, and this formed by the bony part of maxilla, and most posteriorly we have the palatine bones, which form the posterior one-third of the hard pellets. And here we have the posterior nasal apertures, as you see here, and here we have the palatine foramina, which give message for the specific nerve to supply the area or the soft tissue in the hard pellets. Okay, and then here most posteriorly in the middle part of the middle part of the norma bisalis externa. We have the in the middle part we have the foramen lacerum, as you see here, and the lateral to the foramen lacerum we have this foramen which is called the foramen ovale. The foramen lacerum actually communicated with the groove along this area, which is called the groove for the internal carotid artery, and also this groove give the passage for the entrance of the internal carotid artery from the extra to intracranial position. Okay, and then also the foramen ovale in the site of the exist of the mandibular part of the trigeminal nerve to this area, and also we have the foramen spinosum. The foramen spinosum gives the basis for the middle meningeal artery to enter the extradural position, as I mentioned it before, on the lateral view or lateral norma lateralis from the internal position. Here, this is the site of the articulation of the head of the mandible at the mandibular fossa to form the temporomandibular joint, and this is the most important projection, which is called the mastoid process. Okay, and the lateral to the mastoid process, as you see here, we have this irregular foramen, which is called the jugular foramen. The jugular foramen responsible for the passage of the lower three cranial nerves and the jugular veins, the glossopharyngeal nerve, vagus nerve, and then the others. Okay, then we have the another foramen in this area, which is called the stylomastoid or stylomastoid foramina, and this is the give the passage and the exist of the facial nerve from the middle ear to the face or to the area of the face. Then most posteriorly we have this foramina, which is related to the hypoglossal nerve, and also this is the large foramina at the landmark between the two occipital condyles, foramen magnum, and communicated the brain with the spinal cord. Okay, the norma bisalis interna. In the norma bisalis interna, also you can divide it in the norma bisalis interna into three fossae. We have anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. The most deep structures in the posterior cranial fossa. In the anterior cranial fossa, as you see here, we have this area which is related to the frontal bone, and between them we have this area which is related to the ethmoid bone, and in the ethmoid bone we have the small foramina, okay, which responsible for the transmissions of the olfactory nerve, which called the on posterior aspect. This related to the sphenoid bone. This is the base of the sphenoid bone, and here we have the lesser wing of sphenoid bone. In the middle part we have the body of sphenoid bone, and there is a depreciation in this area which is called the sella turcica, and this sella turcica we have another depreciation related to the pituitary gland. Then deep to this area we have the optic foramina, or the optic opening, related to the optic nerve and transmit the optic nerve from the cranial to the extracranial position. And here we have the foramen rotundum. The foramen rotundum responsible for the transmit the maxillary division of the trigeminal nerve, and this is the foramen ovale which I mentioned before in the externa. This related to the mandibular division, and here we have the foramen lacerum, which also I mentioned before, and most laterally, as you see here, this is the foramen spinosum in the middle part. That means on both sides we have these features. Okay, this is the foramen lacerum, and the foramen lacerum exists for the internal carotid artery, and then the internal carotid artery form a little bit groove in this area which called the groove for that internal carotid artery, and then pierce to supply the brain. Then here in the most posterior aspect we have this area which called the posterior cranial fossa. The major part of the posterior cranial fossa formed by the occipital bone or the squamous part of occipital bone, and here we have the part of the temporal bone. The part of the temporal bone consists of this foramina. We have the internal acoustic meatus instead of external on the other side, and also here we have the jugular foramen. Also you can see the jugular foramen on both sides. But as you see here, we have the internal acoustic meatus. This internal acoustic meatus gives interest for the cranial nerve number 8 and cranial nerve number 7. That means entered by the internal acoustic meatus, the facial nerve number 7. Okay, then the other view of the skull, as you see here, this is the norma verticalis. That means from the superior view, in the norma verticalis, we have the sutures, the most common features, the sutures, the sagittal sutures, as you see here, and also we have the coronal sutures. Most posteriorly, we have the lumboidal sutures. The junction between the sagittal sutures and lumboidal sutures is the lamina, while the junction between the coronal suture and the sagittal suture is the bregma. That means this is the most weak point in this area, and also sometimes may be dangerous area. And during the infant, you can palpate the pulsation of the arterial supply in this area, because until now this is act at the fibrous tissue. Then in this area also you can see the two horn of the palatine bones, and also you can find a medullary opening or the foramina like this to communicate the extra veins with intracranial veins. The infant of the skull of the infants and neonates, you can find this fibrous tissue which communicated the anterior part of the skull with the and also communicated the posterior part of the skull. Is it clear or not? Please let me to know something. I hear something around. I don't know. Okay, the infant's skull consists of the two frontal bones separately by the frontal suture. Gradually, these fuse together and form the single bone, and also we have two occipital bone and gradually fuse together to form the single bone. Okay, the junction between the frontal bones and the parietal bones is the anterior fontanelle, and the junction between the occipital bone and two parietal bones is the posterior fontanelles. And this is the weak points at the fibrous tissue and gradually ossify to form the bregma and lambda. Okay, then from the superior view, as you see here, this is the frontal sutures and this is the coronal sutures. Okay, this is the anterior fontanelle, most large than the posterior fontanelles, and this also become bony part in early stage, but this also take about 6 months after birth. Okay, then these fuse together and form the sutures of the skull or of the adult skull. On the lateral view of the skull in the fetus, you can see this also the suturing, which separated the squamous part of the frontal bone of the parietal bones from the temporal bone, and which is called the squamous sutures. And this squamous suture joining two large areas which called the anterior sphenoidal fontanelle, and the posterior one is the posterior mastoid fontanelle, posteriorly and anteriorly, and also this gradually fused later on. That means we have the anterior fontanelle between the frontal sutures and coronal sutures, and we have the occipital fontanelle between the lymphoid sutures and ciliate sutures, and then we have the two on the lateral side, sphenoidal fontanelle and also mastoid fontanelle between the squamous sutures and coronal sutures, and also lymphoid sutures and coronal sutures. This is about the general view of the skull, anteriorly, posteriorly, laterally, medially, and superiorly. And then from the inner aspect and the external part, that means norma basalis externa and norma basalis interna. The cranial or the skull divided into the two major parts: the cranial bones, which contain the brains and meninges, and also include the cranial cavity to protect the brain. And then we have the part which is called the facial bones or the facial skeleton, and this separated the oral cavity and the nasal cavity from each others. And also we have the central bone which is called the nasal septa. That means you can divide the skull into the cranium part, brain box, and the facial skeleton. Okay. In the facial skeleton, we have the maxillary bone, palatine bone, nasal bone, and the others bone. And then we have the about 80 bones related to the cranial cavity or the brain box. And also we have the accessory bones, as I mentioned it before. These accessory bones, we have the auditory ossicles of the ear, malleolus, incus, and steps. And also we have the separated one in the lower part of the neck, or in the upper part of the neck, in the hyoid bone. As you see here, most of these bones in the paired bones, while we have in the just two single bones on the facial skeleton. And here we have the mixed between the paired bone, one on the right side and the others on the left side, and also we have the single bones. The bony part of the facial skeleton, we have the maxilla. The maxilla is the bony part of the upper jaw, and we have the specific formula in the maxilla, which is called the infraorbital foramen, and we have also infraorbital fissure. Fissure sometimes you can find here a little bit along the marginal aspect of the orbit or along the orbit rim. Okay, but commonly from this fissure we have a continuation of canals and then continuous as infraorbital foramen. The articulation of this bone articulated with the zygoma, and also articulated with the nasal bone superiorly, and most above related to the or articulated with the frontal bones, as you see here in the position. Here we have the processing of this bone. We have the zygomatic process of maxilla, and also we have the alveolar process of maxilla, and this from the lateral view. And then from the medial view, okay, we have different features. Later on we'll discuss. Okay, in the bony part of the L shape. Okay, that means we have horizontal portions and perpendicular portions of these bones, and little bit projections at the junction between the two parts. Then from the all form about 1/3 of the heart plate, which I mentioned before in the norma basalis externa, and also share in the formation of the nasal cavity, and also share in the lateral wall of the nasal cavity, most posteriorly related nearly to the posterior nasal apertures. Then we have the lacrimal bones. In the lacrimal bones, we have the two lacrimal bones, one on the right side and the others on the left side. The medial wall sharing the formation of the medial wall of the orbit, and also grooved by the nasal cavity and the duct or nasolacrimal canal. And we have the nasal bone, which act at the bridge nose and continuous anteriorly at the cartilaginous part. And then we have the zygomatic bones. In the zygomatic bones, actually we have the prominences or act at the prominences of the cheek and of the lateral wall of the orbit, sharing the formation of the lateral wall of the orbit, and also had the switching along the lateral border or along the lateral margin of the orbit. And then also part of it sharing the formation of the floor of the orbit, and also joining to the processing which is called the zygomatic process of the temporal bone to form the along the lateral aspect to form the zygomatic arch. That means we have two processing. Here we have the frontal process, and here we have the temporal process of the zygomatic bone. The inferior nasal conicae act as a separated bone attached to the lateral aspect of the nasal cavity and articulated with the different bones like the ethmoidal bones, maxillae, palatine bones, lacrimal bones, and so on. All these articulated to these bones, and also you can discuss more during the nasal cavity or the structure of the nasal cavity. In the median part, we have the vomer bone, which separated the nasal cavity into right and left half and act at the septum between them. Or at the base of the tongue, you can palpate the hard bony part, which is called the hyoid bone. The hyoid bone consists of this part, which is called the greater wing of the hyoid bone, and here we have a little bit projection, which is called the lesser wing of the hyoid bone, and this is the body of the hyoid bone. Then the difference part, the greater and the lesser, and also the body of the hyoid bone, joining or give attachment for the superior or the suprahyoid muscles and the infrahyoid muscles. You can move up and down by the contraction of these muscles. That means the articulation of this joint, there is no clear articulation actually, just connected to the muscles superiorly and inferiorly. Then the functions of these muscles give attachment for the muscles of the pharynx, muscles of the larynx, and also the base of the tongue. That means move during the movement of the tongue during the swallow of the food. The last separated bones and movable bones in the facial skeleton, we have the mandible. Okay, the mandible consists of the body of the mandible, and we have the ramus of the mandible on both sides, right ramus and the left ramus, and then we have the condylar process and chronoid process of the ramus of the mandible. Then also we have the mandibular knots between them. Then the articulation of this joint of these bones, articular alveolar processing of the lower teeth articulated with the roots of the teeth, and also we have the head of the mandible, which articulated with the mandibular fossa to form the temporomandibular joint, the joint of mastication. And then we have the angle, which is joining the body with the ramus, and also we have this foramina, which is called the mental foramina, which transmits the mental nerve to supply the skin in this area, and we have this foramina, which is most important, which is called the mandibular foramina, and this mandibular foramina transmits the innervation which supply, or the inferior alveolar nerve which supply the lower teeth, all the lower teeth by the single nerve. Then this is the mandibular foramina from the inner aspect or from the inner view, and here we have the mental foramina on the other side, and also we have this most important line which is called the mylohyoid line, give attachment to the mylohyoid muscles, which is shared in the formation of the floor of the oral cavity. Then this is the alveolar process, and here we have the base of the mandible. This depreciation related to the submandibular gland, and also in the upper part related to the sublingual gland, this glandular tissue of the or salivary glands. The occipital bone, that means now we finish from the bony part which share in the formation of the facial skeleton, and this is the part or the separated bones which related in the formation of the brain box or the cranium. The brain box, actually in the base we have these bones, mandibular or the occipital bone, and also anteriorly, most anteriorly we have the sphenoid bone. Just let's start by the occipital protuberance, as I mentioned it before in the occipitalis view, and also we have the superior and inferior nuchal lines, and this inferior and superior nuchal line give attachment to the most superficial muscles on the back of the neck. Deep to these lines we have the roughness area, give attachment for the deep muscles. Then also we have the external occipital crest, and this give attachment for the specific ligaments in the median plane of the neck. And then also, as you see here in the arrow, as you see this foramen which called the hypoglossal canal, and this is responsible for the transmissions of the hypoglossal nerve, the last cranial nerve to supply the tongue. Then the articulation of this joint, of this bone, articulated with the atlas, that means the first cervical vertebrae at this area, which is called the atlanto-occipital joint, that means by the condyles of the occipital bone. And this is the basilar part, and this is squamous part of the occipital bone, shared in the formation of the base of the skull, as you see. Then, in the brain box also we have two parietal bones, which is called the parietal bones, and these parietal bones we have the most landmark in this area. We have the parietal eminences, that means the head or the horn of the human body on both lateral side, one on the right side and the others on the left side. And then we have the small foramina along the switches which joining the two bony parts together, okay, it's called the emissary foramina for the transmission of the venous fluxes externally and internally to the brain. Then the articulation of this bone posteriorly, as you see here, articulated with occipital bone, anteriorly articulated with the frontal bone, and on both lateral side articulated with the squamous part of temporal bone and the greater wing of the hyoid bone. Okay, and they form the lateral wall of the cranial cavity, and on the most lateral aspect we have these two lines. This is the superior, or along the lateral aspect, the superior temporal line and inferior temporal line. This line give attachment for the muscles, specifically the temporalis muscles, one of the muscles of mastication, and you can see the movement of this muscle and contraction of these muscles on the lateral side of the skull. The frontal bones, that means the bones which form the forehead, and consist of this part which is called the squamous part of the frontal bone, and here we have the most anterior aspect of the frontal bone, the nasal part or the nasal process, and on both sides we have the projections which related to the or articulated with the zygomatic bone, so that this is the zygomatic process of the frontal bone, okay, along the marginal or the lateral margin of the orbit, and here share in the formation or complete formation of the superior margin of the orbit, okay. And in the squamous part we have the remnant part of the switches, because along the fetal or embryonic development consists of two parts, separated part, and then joining gradually. And here we have the superior orbital margin, and in the superior orbital margin we have a little bit depreciation for the transmission of the supraorbital nerves, which called the supraorbital notch, okay. Then from the inferior view you can see this depreciation which related to the roof of the orbit, and in the roof of the orbit along the lateral aspect we have this fossa which is called the lacrimal fossa for the lacrimal glands, and also you see here this is the supraorbital notch responsible for the transmission of the supraorbital nerves and vessels, okay. In the median plane along the projections, this is the frontal sinuses posteriorly, and anteriorly give the articulation with the nasal bone at the frontonasal switches, okay. And this is the sinus or the frontal sinuses in the median base. Commonly you can find separately, but commonly you can find the single sinus. And here this is the supraorbital notch, as I mentioned it here, the same. And here this is the site of articulation which articulated to the zygomatic bones, and most laterally and posteriorly to the area of the sphenoid bone, okay. This is about the temporal or the frontal bone. The temporal bone shares the formation of the brain box, but most inferiorly than the parietal bones, and posterior to the level of the frontal bone, okay. This is from the lateral view, okay. In the lateral view you see here the external acoustic meatus, or the opening of the external ear, and here we have this process which called the zygomatic process of the temporal bone. The zygomatic process of the temporal bone articulated with the temporal process of the zygomatic bone to form the zygomatic arch, okay. And then we have posteriorly this part which is called the mastoid process. The mastoid process contains the mastoid air sinus, and this mastoid air sinus communicated posteriorly to the posterior wall of the middle ear, okay. And then here we have also projection which is called the styloid process. The styloid process extends downwards parallel to the lateral aspect of the pharynx, and give attachment to the muscles which communicated the styloid process with the hyoid bone commonly, okay. And then here this is the fossa which act at the mandibular fossa and articulated with the mandibular or with the mandible to form the temporomandibular joint, and this is squamous part or the flat part of the temporal bone. The anterior view is differ actually totally from the lateral view. In the anterior view this is squamous part, and this is the site of the switching with the parietal pose, but here we have the most important part of the temporal bone, which is called the petrous part of temporal bone. That means we have mastoid part, and we have the squamous part and the petrous part of the temporal bone, and also we have the mastoid process and styloid process of the temporal bone. The petrous part of temporal bone contains the internal acoustic meatus and also the middle ear or the ossicles of the middle ear and internal ear, okay. this is about the temporal bone. The temporal bone is the most important, okay, and act at the bony part of the iodator system. Then we have the sphenoid bone. The sphenoid bone, in the sphenoid bone, we have the anterior or the superior view. As you see here, this is the body of sphenoid bone, and this is the petrous or the most posterior aspect, and the basilar part of sphenoid bone. And here we have the sella turcica. In the sella turcica, we have a little bit the precision related to the pituitary gland. You can see pituitary fossa, and also on both lateral side, as you see here, this is the foramen ovale. And most laterally, we have the foramen spinosum. Foramen spinosum for transmissions of the middle meningeal artery, the foramen ovale for the exist of the mandibular nerve, that means related to the mandible and responsible for the innervation of the mandibular area. And this projections, which called the anterior clonoid process, and here we have the posterior clonoid process, and this is the foramina, which is called the optic canal. The optic canal extend anteriorly, transmits until to the apex of the orbit and transmit the optic nerve. Then most laterally and deep to these projections, we have this foramina, which is called the foramen rotundum. The foramen rotundum responsible for the transmissions of the maxillary division of trigeminal nerve. And this is the greater wing of sphenoid bone, and this is the lateral wing of sphenoid bone, like the pads. And then this is the, from the anterior view, we have another processing, okay, of this bone, which is called the trochoid process of sphenoid bone. In the trochoid process of sphenoid bone, we have the medial trochoid plates and lateral trochoid plates, and between them we have the small fossa, and this act at the border of the posterior nasal apertures, most posteriorly. Okay. Then in the bony part of the base of the cranium cavity, we have the ethmoid bone. The ethmoid bone, this from the superior view, as you see here, lies in the median plane between the two orbital processive or two orbital part of the frontal bone. Here, the frontal bone on both sides, and in the middle part, this is the area which is called the cribriform plate of ethmoid bone, and give this small foramina for the olfactory nerve, okay, from the roof of the nasal cavity to reach the cranium cavity. And then most laterally, as you see here, this is a specific arrangement of the labyrinth bony part, and this related to the area of the cavities, these cavities which call the ethmoidal sinuses. We have the anterior ethmoidal sinus, medial ethmoidal sinus, and posterior ethmoidal sinuses. In the most anterior aspect, we have this projection which we call the crista galli. The crista galli give attachment for the thickness of the dura mater in this area, and here we have the perpendicular plates which extend downwards in the nasal cavity, okay, to share in the nasal, or to share the parts of the nasal septum, okay. Then that means this is in the anterior view or the posterior view. You see here, this is a crista galli most anteriorly, okay, the projections in the median plane, and on both sides here we have the cavities, that means the ethmoidal sinuses, and this is the perpendicular plates, and here we have the projections from the ethmoid bone, which is called the middle nasal conicae, and here we have the superior nasal conicae, while the inferior nasal conicae are the separated bone. Then finally, actually the defect in the development of the bony part of the skull. You can find it during the embryology lectures. Okay, just here you can find a little bit of the changes during the normal pace, which called the cabits, the accumulation of the specific accumulation of a specific hematoma at the area of the scalp due to the using of specific uh, forces during the normal delivery or vaginal delivery, and this is the give the abnormal morphological changes in the scalp, but actually gradually disappear maybe after pairs by 1 or 2 months. This is about the briefly or quickly about, because actually I take more time now. I think that I take 1 hour or less than 1 hour. Okay, I'm so sorry for coming late, but this is maybe due to the some mistakes in the area of the or technical mistake. Do you have any questions? Do you have any questions, please? Okay, there is no questions. I think that thanks. Okay. What is going on? Just only one presenter.